In today's session, we are dealing with combination therapies more in advanced stages of HCC, where we combine our, let's say, classic interventional therapies together with systemic therapies and modern and developing immunotherapies. The topic of my presentation will be the combination of Y90 together with immunotherapies, a quite complex topic, since we know that the reaction to the tumors with Y90 can be quite heterogeneous depending on size and dose distribution. And the same seems to be true for immunotherapies. So we hope that this session will be an inspiration for future research, where we have more and more collaborate with other disciplines, first to understand what's going on with other therapies, and then to learn how to combine them in a very efficient way for our patients.
In today's session, I think everyone should expect to see a fantastic summary on how people manage complex venous occlusions. And I'll focus in chronic central venous occlusions. And we developed years ago the sniper technique. And my goal is to show to our colleagues that in case they failed endovascular technique, how they can use the sniper technique and do that effectively and safely. So just to call the attention to who could benefit from that, what devices should be used, and what measures should be taken to decrease the risk of complications and be successful to treat their patients.
IDEAS is a multidisciplinary symposium dedicated to aortic pathology, especially for aortic dissections and for aortic aneurysms. This year we have some focus on modified stent grafts that are more and more used by physicians, especially in some acute and emergency settings. If you are a beginner and you want to really learn on how to start a program on aortic pathology, you will probably find what you didn't know. You will find experts who can ask questions, and if you're a highly expert, you will see very complex procedures which can probably help you also and give you some solutions in some cases.
In today's session, we will talk about complication management. On the one hand side, I will talk about is how to deal with complications during intervention, but there will be also other presentation from my colleagues regarding the situation afterwards, when you have to talk with relatives or with your colleagues when a complication occurred, especially if we are talking about major complications and adverse events. So this is something we want to talk today about, and also to develop strategies how to deal with in certain situations.
So here at CIRSE in 2025, Terumo is also celebrating a 40th year anniversary. So alongside CIRSE, we're celebrating 40 years of the RadiFocus Guidewire M on the marketplace. And we have a very special program with 3 symposia and a packed program in our educational centre, the Terumo Learning Edge. And also we're featuring our usual product portfolio, so Destination, Navicross and Glidewire Advantage, knowing that you can only treat what you can reach, so really helping with that therapeutic lesion access field. And of course our therapeutic range, including the Roadsaver carotid stent and Renzan, our novel dual braided micromesh peripheral stent.
This year at CIRSE, from Siemens Healthineers side, we have the biggest booth we ever had at the CIRSE conference, so we are really proud, and I think this is a statement and it shows the importance of IR for us at Siemens Healthineers. So what is new? First of all, we show the interventional MR suite. This is what you can see here is an absolutely brand new product. It's a complete interventional suite with all different components. We show interventional CT, and of course what we also show icono sealing.
Interventional radiologists use every modality to render life-saving therapies. And at Siemens Healthineers, we're bringing all those imaging modalities together to help the interventional radiologist move seamlessly through their day. Whether you're starting with ultrasound or moving to angiography, ablation with CT, and the future of interventional MRI, all of that comes together through therapy. So the therapy links through software all of the imaging, and that's what we're showing here at Siemens Healthineers.